Good evening. My name is Valerie Napawaki. This is my disabilities presentation on language delays and disorders. According to the specialeducationguide.com, a language delay is a delay in acquisition of language skills compared to one's chronological, cognitive, or intellectual age. However, a language disorder is a significant impairment in the acquisition and use of language across modalities and/or production across any of the 5 language domains: morphology, phonology, syntax, semantics, and pragmatics. There are 2 subdivisions of language disorders. One is an expressive language disorder, inappropriate word usage or sentence structure, which creates an inability to express oneself to others in words and phrases. The second is a receptive language disorder, which is the inability to understand what is communicated in words or phrases. Classification under IDEA. Language delays do not have a classification under IDEA. Usually, children with language delays at 24 to 30 months can usually catch up with their peers within a few years and do not need intervention. However, children with language disorders would be categorized primarily under speech or language impairment. However, there are other disabilities where children can show some language disorders as well. Those disabilities would include autism, intellectual disability, traumatic brain injury, and specific learning disabilities. Prevalence in society. According to the Partners Resource Network, about 5 to 10% of children are affected by language delays. However, language disorders affect about 1 in 20 children, according to the National Library on Medicine. Your chart to the right is a chart provided by the National Health Interview Survey. It was a survey conducted in 2012, and it shows the percent distribution of types of communication disorders among children ages 3 to 17 and ages 11-17. The piece of the pie right here for children ages 3 to 10 years shows that 13.6% of children show language problems only. And in the second chart, children aged 11 to 17 years at 23.2%, which show language problems only. This survey defines a language problem as a problem with learning, using, or understanding words or sentences. Causes. Language delays do not have a primary cause. Some children are just late bloomers, or there could be a family history of language delays. However, language disorders have several causes. It could be family history, premature birth, autism, brain injury, intellectual disabilities, cerebral palsy, poor nutrition, Down syndrome or Fragile X syndrome, and fetal alcohol syndrome, which can contribute to a language disorder. Identification. Language delays are harder to identify because the child shows normal language development, it's just delayed compared to peers. However, language disorders identified by improper use of words and their meanings, inability to express ideas, inappropriate grammatical patterns, reduced vocabulary, inability to follow directions. The chart on the left provides a guideline for when to see a doctor about your child's language development. At 15 months, your child is still speaking in 2-word sentences. At 2 years old, your child's vocabulary is limited to fewer than 25 words. At 3 years old, your child often repeats your question or does not speak in full sentences. And at 4 years old, your child is still speaking in 2-word sentences. You would want to consult your pediatrician. Screening can be done by your primary physician or pediatrician, and then referrals would be made after a preliminary evaluation. Screenings consist of parent reports, observation of a child at play, standardized tests that include receptive and expressive accountability, comparison with children of the same age, developmental charts, or medical reports. Some psychological and behavioral characteristics of children with language delays would be low self-esteem and confidence, and children with language disorders may have depression, anxiety, stress, and also possess low self-esteem and low confidence. Social and emotional characteristics of children with language delays would be difficulty following instruction, social isolation, difficulty accessing curriculum. They could be a target of bullying, low academic performance, and difficulty reading and understanding social communication. Children with language disorders can have these same issues, as well as difficulty understanding jokes, difficulty self-regulating behavior, and extended difficulty in academic assessment. Suggestions for teachers with children with language delays and disorders would be to create an individualized plan with teachers, parents, and specialists. Multisensory approaches to learning words, such as touch, sight, and taste, can help. Visual displays along with directions. Provide educational staff with information to help the student in the classroom. Provide extra time. And the website KidSense at childdevelopment.com was very helpful and provides other advice. Suggestions for parents would include consult a pediatrician and early screening at the first thought of a language delay or language disorder. Frequently talk, read, and listen to your child. Participate in fun activities that would include vocabulary, reading, and visuals. 2 websites that would be helpful for parents would be the Partners Resource Network and KidSense. These are my resources. Thank you very much.